All right. Well, thank you so much for inviting me here to talk about what we're doing to change healthcare. So my background is in IT and healthcare. Was a software engineer for many years and then went on to become a clinician. And then 10 years into it, I decided it's time to make some changes in what I thought were very difficult circumstances that patients and physicians find themselves in. So we all agree that it is much cheaper to get an oil change on a regular basis than buy a new engine, right? Well, same thing in healthcare. It's cheaper to get primary care, in other words, seeing your doctor on a regular basis, than it is to get surgery. Not only is it expensive monetary-wise, but emotionally and everything else. But why is it that people don't get to see their doctor on a regular basis? Well, one of the reasons is because it's difficult to do so for a number of reasons. If you're going to fix anything, obviously you need to know what you're fixing. And what we've heard over the years is that healthcare is just so complicated, it's difficult to fix. Well, we sat back and said, what are the things that need to get fixed in healthcare? And if you look at healthcare, there's a finite number of steps, very specific steps, that one has to go through to get health care. The first thing is you got to find the doctor or the clinician. Once you found the clinician, you need to be able to book an appointment. Once you've booked the appointment, you need to get all your documents in order. You need to fill out the paperwork, and then you get your health care. After the care, there's a follow-up. And what we noticed was that every one of those steps has its own problems. Finding healthcare providers is difficult. Booking appointments is very difficult. And then you go down to filling out paperwork. Anyone who's ever been to a doctor's office, there's a pile of paperwork that's asking you the same information over and over again. What's your date of birth? Oh, by the way, what's your date of birth? Again, well, it hasn't changed since the last time. Still the same. And then, of course, you get into the part where you actually, the meat of why you're here, the receiving of care. And what we give you is 5.2 minutes for having waited 24 days, which is the average in the US. We give you 5.2 minutes to tell you what's wrong with you, diagnose you, and treat you, which we all know is not working, because the outcomes in healthcare tell us that healthcare in America is not getting better, it's getting worse. And yet we're more technologically advanced than any other country. We have the best machines to diagnose, to treat. But it still comes back to this: healthcare is a personal business. It's between a clinician and a patient. The amount of time that I spend with my patients is directly proportional to the outcomes with that patient. If I get the chance to diagnose my patient, treat my patient, communicate with my patient, and find out some things that may not be health related but have an impact on their health. For example, the fact that my patient doesn't have transportation tells me that they don't have the ability to go to the grocery store and pick up the food that I'm recommending is good food. That means they're going and picking up TV dinners and having food that is high in sodium. But that's just because the system that we're set up in from a business perspective does not allow the patient and the healthcare provider to do business. There are all these intermediaries in between, people who want to get paid. And the last time I checked, the only person that does the paying is the patient. So you got 6 people between the provider and the patient. Every one of them wants a cut. And the only person that's doing the paying is the patient. The name of my company is Hutano, which means health in my native language, Shona. What we did was look at all the processes that are involved in providing health care. So those 5 processes, every one of them has a direct impact on how efficient the system is. What we've seen other providers do in the past is they will go and solve the problem of finding healthcare providers and booking appointments, but not address the problems below. Therefore, what happens is you're able to get into the doctor's office really quick, but you're still sitting in the office for 45 minutes to get seen. So here's what we did. We created a website and an app that you can download on the app in the App Store and the Google Play Store. It is fully functional as we speak, and we have real doctors on here, including myself. So I'm just going to walk through some of the things that we did here. So if you look up here, you have your location where you are. You're going to specify how far you want to go to find this doctor, this clinician, this physical therapist, dentist, chiropractor, whatever you're looking for. Why does that matter? Because most people are looking for a clinician in their neighborhood. I don't want to drive 20 miles to go and see a pediatrician for my kid. So narrow it down to where you want to go. And then the next thing is, what are you actually looking for? And we try to simplify this. Most people might know the specialty they're looking for. Say they're looking for family practice. Or they may know the name of the clinician. Or they may know the service they're looking for. Say someone is looking for a COVID-19 test. You type in COVID-19 test, and then we show you all the providers that provide that service. So in this case, if we're looking for a family practice doctor, there they are. We've got these two. Now we go to the next problem, which is most people who have insurance have a very high deductible. That means they have to spend sometimes $5,000, $10,000, $15,000 before our insurance dollars actually kicks in. And then we have a lot of people who just don't have insurance at all. As a matter of fact, if you combine those two groups, they make up 51% of all the people that could be insured. That means most of healthcare in this day and age is actually cash-based. And yet we are spending so much administrative time going into doctors' offices and having all our payments processed through this overhead-intensive organization called insurance, costing the doctor's office a lot of money, costing you a lot of money. As we've seen in a lot of cases where people walk in with insurance, they actually end up paying more than people that come in and just pay cash. How that works, it's only in America. But wouldn't it be nice if you just knew what you were in for it before you even walked in? You want to go see Dr. Hamza? It's $250. That's what she charges. If she takes insurance, you can see exactly what insurances she takes. That saves you having to pick up the phone, calling Dr. Hamza's office. 15 minutes later, find out she doesn't take your insurance. Now you have to do that process over again. Now, when it comes to a clinician that you know, just make an appointment with this one. You folks are familiar with this guy. That's what I hear. Apparently he's a 4.94 stars. So somebody didn't give him 5 stars. So here's information about me, how I deliver care. You can come to my office. I can do it virtually. Or I can also come to your office, your house, or whatever it is. We're the only platform in the country that does this. We allow clinicians to hang a shingle on this platform and say, right from day one, you can come to my office, you can come in virtually, or we can do on-site. So you don't have to have 3 platforms to do your business. Now let's go ahead and book the appointment. In my case, I do not take insurance. If you want to see me virtually, it's $45, and it's a 25-minute call. You want to come to my office, it is $80, and that's a 45-minute visit. Otherwise, I have all these other services. If you wanted wound care, for example, it's $100, and it's a 60-minute visit. This is all the time that we waste, the overhead that we've built into healthcare that can be answered right here on this website. Instead of picking up the phone and having to hire 2 or 3 people to answer these questions between 8 and 5. This practice can be open 24/7, 365. And we don't have anything today, but guess what? Tomorrow at 8 a.m. at this location, if there were multiple locations, they would show up and you choose a location that you want. And let's go and hit next. So there's a song and dance we do every time you go to any clinician's office, even if they're next door to each other. Everyone gives you a pile of papers to fill out. That shouldn't be the case because human beings, we just don't change that much over a period of 24 hours, even a number of years. So the first part is the consent to treat. You've signed that every time you go to a clinician's office. Why not just sign it right here? Your medical history typically doesn't change very much. If anything changes and you want to add something in here, You sure can. Let's say you had, we say a hip labral tear, for example. When was it? And save it. All right, so that's my medical history. So the next thing I'm going to do is my social history. Do I smoke? Do I drink recreational drugs and all that kind of stuff? As you can see, what we're doing here is we're building a case based on what you have already done in most clinics that you've gone to. But the good news here is that when I go from this visit to the next visit, I never ever have to do this ever again. So I can go in and just hit next. That's what I'm allergic to. What's the issue here? This is a new health issue. And let's talk about what exactly it is. So I've got aches and pains, and we've got all the categories that represent the entire body, whether it's mental health issues, female health, male health, and all that good stuff. Now, this is the part where we actually get to ask you what is going on. And if you folks remember this, the last time you went to a doctor's office, it sounded kind of like this. Tell me what the problem is. What really hurts? Well, it's my knee. All right? And left or right? It's the left side. Okay, save that. Anything else that hurts? Yeah, I also have a hip problem. Left or right side? The right side. Okay? Now, tell us the quality of the pain. What's going on there? Well, it's numb, it's tingling, it's draining, whatever the descriptors are. On a scale of 0 to 10, how would you rate it? Oh, it's a 2. What makes it better and what makes it worse? Well, when I rest, when I sleep, when I take medications, that makes it better. However, what makes it worse is when I walk, when I sit, and when I stand. How is this affecting your daily activities? Is it debilitating to the point where you can't do anything, or is it just an annoyance, or does it not bother you at all? How long have you had the problem? I've had it for days, for weeks, for months, but in any case, choose the one that works for you. Is it getting better, worse, or is it improving over time? In my case, let's say it's getting worse, and yes, I was treated for this condition before, and where did I get my care? 3 weeks ago, I went to the emergency department. And if there's anything else that I want to capture in here, I can go in and just type little notes about what's going on, right? So this in itself captures the minimum amount of data that any clinician needs to know what is going on. And each one of these questionnaires is a little different depending on what you're complaining about. When you're done with this, we then ask you, are there any images that might be able to describe your condition a little bit better? You have a rash. Take a picture of it and show us what that looks like. When this has happened for me with my patients, it is, I can say healthcare has changed because all of a sudden my patient walks in, I have more information than I have ever been provided. This gathering of information typically would take the first 15 to 20 minutes of my visit with a patient. And if we can do it up front, we're making the system a little more efficient. Otherwise, the next part is just as important. Do you have any medical documents that could be lab reports, lab results, MRI results, X-ray results that you could attach to this? Again, you can take a picture of it or upload it directly from your computer, and then you're good to go. And when we compare it to how we do this right now, immunization, same thing. Take your picture of your immunization cards, the dates and the times and what kind of immunization it is, and you're good to go. And then one of my favorites is the medications. I worked in the emergency department for 4 years, and anytime somebody came in with their medication list, sometimes it's a medication list that's written out and it's laminated. Sometimes it's a bag of medications that they take. And then we have to take them all out and kind of read all the medications, try and figure out what's going on with them. What we have done is you as a patient can go in and put in the medications that you're taking, the dose, when you are prescribed those medications, and they sit here through eternity. Now, if a doctor reviews your medication, I prescribe a medication, and some other doctor comes in and says, hey, you know, you're taking this medication, and I think that's the reason why your kidneys are not functioning really well. I'm going to lower the dose. When they do that, that record is kept in perpetuity on here. So it will show you that this was added or this was reviewed by this doctor and the reason why it was reviewed. the power of this is if I find myself in Machu Picchu somewhere and the doctor there is trying to figure out what meds am I on, what meds have I been on in the past, and if there's a med that was reviewed or discontinued, why was it reviewed or discontinued? Your entire story is sitting right here. Right now, we just guess. If you come in and you are incapacitated and you can't tell us what's going on in the emergency department, we'll see. Let's keep an EpiPen close by just in case they start dying. So that it's not a good plan. So this really helps our patients at least have that medical record with them no matter where they go. Now you can just tell us what pharmacy you get your medications from. And then when all is said and done, if you've taken your vitals, for those of you who are clinicians, you know that when you go to the doctor's office, you're going to spend what? The first 10, 15 minutes doing things that you could do yourself. In this day and age, taking your blood pressure is something that does not require any medical skill whatsoever. You can do that at home. And typically, you get a bit of reading at home where you don't have the white coat syndrome, people watching over you and your blood pressure is, through the roof. So anyway, if you did take your blood pressure, tell us what it was, and when you use our app, you can track this blood pressure over a period of time. And as a clinician, I'll be able to see what the trends have been over time. Oxygen saturation. And what's really interesting about this is that the equipment that we have on our wrists now is almost medical grade equipment now. I can check most of these vitals using my Garmin or your iPhone. In the past, they were not as accurate. Now it's literally as accurate as anything else. But what are we doing with this data? It's really nothing. It would be nice if we could flow it into something like this that then a medical profession can make some decisions on it. Most of us know our weight. At least it fluctuates after a dinner like this, but that's all right. And then here we are. The software literally writes a story of what you just did. This is a 48-year-old male. This discomfort level 2 out of 10, started 4 days ago, received care for this problem via emergency department. For those of you who are clinicians, this here is the actual story that we put into our medical documentation. We call this the history of present illness. This typically takes clinicians anywhere between 5 to 10 minutes to do. We save them a ton of time on the back end, which in turn is time that they could invest in you as a patient or in their family if they so wish. At the end of all this, I'm going to pay for the service. And let's send that request in and done. That's the end of it. So that's how we are changing healthcare. Our need at this point is to get more clinicians on the platform, get more patients on the platform, get more people using this kind of, we're not in competition with insurance companies or physicians' offices. In fact, we're just complementing them and giving them a platform to do their business more efficiently, which should be a win-win situation for everybody involved. I would take questions at this point. Sure.
One of my questions would be, originally back 15, 20 years ago at least, the federal government required doctors to basically digitize all the records. I thought the intent of that was so that one doctor's office could provide another doctor's office with information, but it doesn't seem to be that way because, like you said, every time I go to a doctor's office or I take my wife to a doctor's appointment or even just to have, like the other day, I took her in for an ultrasound on her breast for follow-up mammogram, and the same company I've been using for all her other imaging stuff had to fill out paperwork again. It's just every damn time they hand you a sheet of paper. I thought, like you said, we have to put this all together so one hand knows what the hell the other one's doing.
Yeah.
Not really working or what?
Yeah, so the main challenge there is that the electronic medical record software companies do not have an incentive to talk to each other. In fact, it's market share for them. If you go to a specific healthcare system in this town, what do they gain from sharing those records with another competing system? And they really don't. The incentive is very low. So what we end up doing with our platform is what our platform does is basically allow the patient to be at the center of their care. Instead of us going and negotiating with all these entities to talk to each other, we're now saying you, the patient, you can call all the places that have your medical documents or your wife's medical documents, upload all those medical documents onto our platform. For your convenience, when you go any place you go, if they don't have your medical documents, you can just say, hey, here are my medical documents. I can share them directly with you from this platform to you, or you can join this platform and you can see those medical documents. So that's how we're trying to solve the problem.
But if I'm representing the member that says, sorry, that's a great application, we love it, but we're not a subscriber, we're not a participant, fill out the form.
Yeah, I think that's always going to happen. I think we're going to run into folks that just resist that altogether. But I think as long as it's patient-driven, as long as you, the patient, are coming in and saying, this is where my medical records are, they have to, at some point, go, you know what, if we need the medical records, this is where we're going to find them. But it's going to take a while for us. We're going uphill in a lot of ways here. So we kind of recognize that as well. So.
What is the cost on both sides? What do you charge the physician to be part of this, and what do you charge the patient that is not picking the doctor at this moment for him to use your services?
So for the patient, it's free. For the providers, our charges, we have two charges. They can either subscribe on a monthly basis, unlimited number of patients go through the system for $300 a month, or $20 for every patient that processes through the system. So after a certain number, they go, you know what, let me just do the unlimited anyways, and they get the full suite, the EMR, the ability to do in-clinic, in-office, and virtual plans.
So as far as the regulatory authorities, my business life is like that. I know in that business is too. I guess that's going to be the uphill challenge of kind of figuring out what now. And then just to see, understand, this is really a continuity to connect, but also for the end user patient. It's a way to just have everything summarized in one place for you to be able to show feedback. So if you go to the hospital, you can pull up your app and go up because
Correct.
give them, especially if it's emergency, give them a real good read.
Exactly, yeah. Yeah, so and we're opening it up now to where clinicians don't have to, they can get an account called a reviewer account. They're not subscribing to our services, except for they can get into the platform, log in, and a patient can give them permission to see their records. So you may not be subscribing to the telemedicine and everything else we do, but at least you're able to see patient history, and you're able to refer that patient to another clinician. As far as the regulatory part of it, HIPAA has been blown out of proportion by most people. Really, all it is simply this. As a clinician, I cannot share information with anyone you have not allowed me to share that information with. As a patient, you have 100% rights to do what you want to do with your medical records. If you tell me to send your medical records to your Gmail account, that is your business. If you want to put it on Facebook, that's your business. But I cannot do anything that you haven't allowed me to. So what we're doing with this app, with this platform, is basically saying, these are your records. You do what you want to do with them from here on. So if anything, we are more HIPAA compliant than most platforms that we've seen. Sir.
I just wanted to say this sounds extremely useful because there has been times, and you talked about this challenge, where I searched for a healthcare provider specifically through my insurance, only to find that the information was inaccurate. That means that when I called, let's say a health provider, they said, "Oh, we're not part of that network." I said, "Well, you're listed on here." And I said, "Well, that's sorry, but we're not." Or some, what you are charged as a patient depends upon what tertiary you belong to, whether you're first or second or third or whatnot. And that has been also inaccurate, where I've an appointment, it says your first primary, you get the extreme discount, go there, and then they say, oh, no, you're not up here, you're down here. And I said, hey, but it says, oh, sorry.
Yeah, and I think that goes down to that whole business model where there's too many people between the doctor and the patient. It's just way too many. Sorry, sir.
Yeah, I'm sure you've done the calculations. What do you think you need to achieve a profitable business on the clinician side? How many clinicians do you need to have on your platform in order to create a profitable platform?
So what we look for is traction. So what we really need is 50 clinicians that represent a wide range of services. For instance, primary care we know is really important. People look for those all the time. Gynecology services. 50 providers can reach close to 20 or 30,000 patients, and that's the ratio is in our favor in that respect. And at 50, we probably have one of the biggest virtual practices in the city. So 50 is a good number for us to make this work. Mm-hmm.
We're wrapping up. All right. Thank you very much.
Thank you so much. Appreciate it. Thank you.
That was very, very informative. And,
Thank you so much.
I, for one,
Oh. Oh, yeah.